Stop scrolling. As public health students, we need to talk to you about a systemic error that is occurring here in America that is harming African American mothers.
This isn't just a history lesson. It's a modern health disparity that affects every community and family across the country.
It's called the Black maternal health crisis, and understanding it is crucial for anyone interested in public health, equity, or social justice.
The statistics are surprisingly shocking. In 2021, the maternal mortality rates for non-Hispanic African American women was 69.9 deaths per 100,000 live births.
That is 2.6 times the rate for non-Hispanic white women, and this gap is widening, not closing, which is a problem.
It's because these mothers are more likely to experience serious complications like preeclampsia, postpartum hemorrhage, or blood clots. They also have higher rates of low birth weight and preterm birth.
Even mental health is affected. In African American women, they report postpartum depression at 18.2% comparatively to 11.4% for white women.
So is this just about income or lack of insurance? That's what many people assume, but it's actually really not.
A study proved that the wealthiest Black women in California still had a higher risk of maternal mortality than the least wealthiest white women in California. So wealth does not protect Black mothers.
And this is systemic. Even when African American mothers presented for prenatal care at the clinics for all of their trimesters, they still had 4 times the risk of maternal death comparatively to white mothers who did the exact same.
The core drivers are differences in access to quality care, health insurance coverage, and most importantly, racism and discrimination within the healthcare system itself.
And this isn't biological. It's rooted in the bias and the historical trauma that gets carried into the clinical settings.
So what can we do as public health students and as college students? We can demand accountability in healthcare systems and stand up for these women.
We need hospitals and healthcare providers to standardize emergency care. They should be trained to manage chronic conditions like hypertension and diabetes during pregnancy and provide quality, effective care to all patients.
And for pregnant women like me, we can share the urgent warning signs that they need to look out for: trouble breathing, heavy bleeding, severe headache, and overwhelming tiredness. These are emergencies, and you definitely need to get checked out if you're experiencing these.
On a policy level, we should support efforts like the Black Maternal Health Momnibus Act of 2021. This aims to expand telehealth and improve care for Black mothers.
And a proven path for better outcomes would be to expand Medicaid and extend postpartum coverage for a full year.
This isn't just a problem about equity, quality of care, but it is really about life itself. As students, as future healthcare leaders, it is important that we keep this conversation going so we can bring hope and highlight the systemic error that is occurring here.